bone. So my indication would be, or my inclination would be, to find the joint line and go immediately above the joint line. And if you want to, you can just angle slightly up. But you can go straight across at this level. This bone will be very soft. It won't be hard to go through at all. This is an area where we normally lay plates, so it's an easy exposure. Obviously, you have saphenous vein and saphenous nerve to just look out for, but you make a small linear incision right here, blunt dissection down to the bone if you want with a hemostat, and enter the bone here. And it's going to be, as you can see, I'm really about no more than a finger breadth above the defined joint line. And that's where I would be going, as opposed to where I see on x-ray the approach, which is more toward the diaphysis than it is down toward the metaphyseal, epiphyseal region, which would be down in this area here. But this is where I would tend to enter the bone. And again, the approach is, do you want me to make a hole? Or?
Yeah.
Yeah. So the approach here is light pressure, and you can see how far the rotation is. I'm rotating quite a bit with light pressure. Mostly rotation, a little bit of pressure, and I'm shaving the cortex. And you'll find that this cortex is going to be a lot easier, super easy, compared to the cortex much higher. And you want to go in until there's no resistance left. And by doing this sweeping back and forth motion and basically shaving or paring the cortex, I'm not locking the trocar tip at all. I'm putting very little load on that tab. So now I'm down, there's no more resistance, and the depth stop of the trocar tip does its job. So I made that hole right there, and you can see where I am in the upper portion of the medial malleolus above the joint line. At that point, take off the trocar tip, take off the the removal tool, cycle it a couple of times or once, and then come in, where your joint line is, come in parallel to the joint line. And you're going to find that there's a tremendous amount of metaphyseal bone in this area that you can harvest. And you're not going to harvest down, you're going to harvest straight across, parallel to your joint line mark, and then slightly up, and there'll be a lot of bone all around in this area. So that's the approach I would use. Now I'm going to demonstrate on our demo block what could happen under